I'm Commissioner Christian Leinbach, and I want to welcome you to our Berks County Board of Commissioners meeting for July the 9th. As always, we will begin with a moment of silence, followed by a pledge. Please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. This morning, we're going to begin our program with a public hearing. This public hearing is required as part of the Human Services Block Grant for fiscal year 2020 and 2021. I want to turn the meeting over right now to Dr. Ed Mahalik. Dr. Ed oversees the Human Service Block Grant program for the County of Berks. Dr. Ed.
Good morning, commissioners, and good morning, participants. I'd like to join with the Board of Commissioners in welcoming you to our second public hearing. Our first one was held last Wednesday. We had 90 registrants and roughly 60 people participated. And this will be our second and final hearing before block grant submission. First, can you put the slides up, please, Heather? Okay, this is for fiscal year 2021, which begins or began July 1st. We're going to review the expenditures for the last fiscal year and the consumer numbers and talk to you very briefly about the new year. I want to point out, and I'll point it out at the end, that most people are aware, but I would like to make the public aware that we're operating on a 5-month budget through November 30th. So our funding, at least up until that point, is flat funded. And I'm sure there'll be a budget after that, but we're hoping to and expecting that we will have a flat budget through the rest of the fiscal year through June 30th of 2021. But in these times, one can only hope at this point. Next slide, please. Okay. Just briefly, and many on this call, I'm sure we're aware that this was the first block grant program was implemented July 1st of 2012, and Berks County was one of the first people into the pool, so to speak. And we're very happy that that happened because, as you see, once again this year, we had the flexibility to rechannel funds to help the homeless and people with rental assistance this year who have been victimized by the COVID-19 pandemic and the shutting down of our Commonwealth. And I'll talk a little bit about the future of that in a little bit. Early on, there were 7 categoricals with no flexibility, as you can see. In subsequent legislation, it was trimmed down to 6. The one that had fallen by the wayside is Children and Youth Services Special Grants. The categoricals include mental health, developmental disabilities, the Human Services Development Fund, Homeless Assistance Program, or HAP, and 2 drug and alcohol funding streams, the Behavioral Health Services Initiative and Act 152 drug and alcohol funds, which our executive director from COCA, Stan Papadimitriou, he will join us in a little bit. We have benefited greatly from this program, and we're entering the 9th year as of July 1st, 2020. This is the 9th year of the Human Services Block Grant, and we now enjoy full flexibility. And with the commissioner's support and agreement, we have been permitted to move monies around, and I appreciate that ability. We're going to talk a little bit about implementation. If we can move to the next slide and then the one after that. Next slide, please. These are the summaries for fiscal year 1920. Now, I do want to tell you that the dollar amounts are for the current fiscal year, The consumer count is for last fiscal year. Obviously, with this fiscal year ending June 30th, the numbers are still coming in on the amount of individuals served, but you can assume pretty much that the numbers ending this fiscal year will be very much the same. You can see a total of roughly $13,131,742. That includes the funding streams of both mental health and developmental disabilities. Now, some people will say, we know there's a lot more people in the developmental disability system and there's a lot more money. You are correct. Most of the monies in the developmental disability system come from the federal government through various federal waiver programs, and they are administered directly by the Department of Human Services Office of Developmental Programs with contracts directly to providers. As of May 2020, we have over 554 individuals enrolled in the consolidated waiver. 447 additional people are enrolled in the person-family directed waiver, 143 people in the community living waiver, and 168 individuals served through the base funds that you see above. That's the roughly $3.3 million. The slides, as you can see, list all the programs that are funded by this. I will tell you, if anyone member of the public wants a copy of the slides, that they are available to you. You can email us at tevans, T-E-V-A-N-S, at countyofberks.com, and we'll be happy to share with you the slides from this presentation. Next, please. Human Service Development Funds. This program was designed to encourage new and innovative human service programs, but over the years, particularly over the past 10 years, the program has been cut through various legislative actions from approximately $1 million to what you see here today, $332,352. You can see it still serves 2,511 people, and I think that's an important number because this is still an important part of our funding, and we will be accessing and advocating that this money remains stable. One thing about the Human Service Development Funds, we were able to move money from information and referral, which you can assume is exactly as it's stated, and we were able to support additional medically fragile individuals under 60 to receive Meals on Wheels. And that was critically important in this pandemic time because food security is a critical issue, and between that and housing, we have really changed the way we've done business through this pandemic. Next slide, please. Homeless Assistance Program, a very hot topical area, I would say. This past year, last year, the fund, this year's, that's $455,873. You can see it encompasses bridge housing, rental assistance, and case management. The county contracts with the Berks Coalition to End Homelessness, which then takes this money and spreads it out through various agencies throughout the county. The rental assistance program managed by the Berks Community Action Program gave out smaller grant amounts to a larger number of households during the past year. Next slide, please. Do you know if he's on?
He's not yet, he's trying.
Okay. These are two drug and alcohol funding areas.
I told him to get on.
Our COCA executive director is trying to get his way in, and we're trying to help him with that. He will be able to address some areas in the next couple slides. This is the BHSI, or Behavioral Health Services Initiative projections, and Act 152. Various funding streams come through the county, and then they are channeled to the Council on Chemical Abuse, which is the single county authority. And here is the monies that come through here through state government, particularly through DDAP and the Department of Human Services. So there's $1.131 million for that. And Act 152 is roughly $358,000. Because of the flexibility of the block grant, unspent mental health money for the current year was given to COCA once again to fund treatment and drop-in center services. And that's an important part of the flexibility that I've mentioned early on, and I will mention a couple times through this presentation. The next slide, please. Okay, when we talk about flexible funding, we were never able before the block grant to move money across cost centers. Not with jumping through a lot of hoops, and most of the time it was unsuccessful, but due to legislation, due to this Board of Commissioners support, in fiscal year 18-19, we moved money, almost $63,000 moved over to HSDF. Almost $68,000 went to support housing assistance programs, particularly when we saw a spike in needing to house people, particularly the homeless. And $350,000 went to the Council on Chemical Abuse, as I had mentioned earlier. So this is one of the hallmarks of the block grant program. This is why we did it. People will say, well, why didn't you use that money? Where did it come from? We have a program that takes people out of the state hospital called CHIP, not to be confused with the insurance program for kids. And we're able to take unused money for CHIP in this year and move it over to other programs. Next slide, please. One of the last things of the block grant that I should mention to you is we're able to retain a certain percentage of money that we don't use and push it into next year. So the money from 17-18 was pushed into 18-19 and funded a following, I'm sorry, the money from 18-19 was pushed into this year. So we were able to reallocate monies to the following initiatives. Many people have seen our bus and our ads on billboards for the Berks Suicide Task Force. We're very concerned about suicides rising with people's livelihoods being affected. We did mental health first aid training for home healthcare workers, funded a transition expo, expanded our forensic program. We became part of the National Stepping Up Initiative in March of 2019, and we were able to fund a living situation for people to get them out of prison earlier, because we found people were staying longer in prison with behavioral health disorders and no place to go. And of course, we were able to fund personal protective equipment to our providers and many advertisements related to the COVID pandemic. You will see the ads on our buses, BARDA buses, as well as advertisements throughout the county. Next slide, please. This is one of the more exciting things I like to talk about, is our forensic initiative, because this is a program that we have been recognized nationally. Initially, we're one of 12 counties in the nation, and the first one in Pennsylvania to be to become part of the Stepping Up Initiative, and also to be named an Innovator County in March of 2019, as I mentioned. The goals of Stepping Up are on the screen in front of you, but for those of you listening by phone, is basically what we do is we intercept people at various points in the criminal justice system with behavioral health disorders through partnerships with probation and parole, law enforcement, our magisterial district justices, our central processing unit overseen by our sheriff, and other levels of the court system. And some of our partners include our sister agencies within Berks County, like the Berks County Jail System and the State Correctional Institute. The goals are to identify interventions that assist to divert people at various intercepts, to reduce the length of time while incarcerated, and to prevent recidivism, because there is a high recidivism rate nationally that affects people with behavioral health disorders. Next slide, please. Here are our highlights from our diversion program. Through January 12th through June of this year, 751 diversions, which is an incredible amount of people. That's 751 people that would have been in our jail system. We implemented in the fiscal year, we're talking about 17 transitional apartment units. 46 people have been funded in these apartments, and we're about to embark upon an exciting initiative with Berks Connection Pretrial Services to devote specific employment coaching services, because the other key part of this is to get people to become employed and to support them until they can do that on their own. That's going to start very soon. In fact, the commissioners just inked a contract on that, so we're really excited about that. Next slide, please. Okay, what has been the Data-Driven Justice Initiative, which is intricately intertwined with the Stepping Up initiative, these are our accomplishments. We created a data governance strategy, and that's important because it sounds, quite frankly, like gobbledygook. And if you don't understand the technical aspects, it is gobbledygook, actually. But we have to create a framework that we share data among agencies while protecting people's personal health information. And right now we're doing it in aggregate using something called the Open Lattice platform. So we create a de-identified data set. That means we're not able to look at individual people except the agencies that are able to do that. However, we use the aggregate data to inform the Board of Commissioners and other stakeholders as to how we can make important policy decisions. Without the data, it would have been difficult to divert all those people. Our partners are the Health Choices Program, the jail system, the Homeless Coalition, among others, adult probation, COCA, and Service Access and Management, and Berks Connections pretrial services. Next slide, please. Okay. Where are we going? We intend to create reports for each system, to create reports across agencies for pools of individuals that we can then make policy changes and program implementation. We share the successes for each of the intercepts, and we will also be able to evaluate the cost of these services and their cost effectiveness and efficacy, and identify areas for improvement and be able to make intelligent recommendations based on data to our Board of Commissioners. Okay, at this point I'd like to turn, we only have a few slides left, but I'd like us to turn this over to Mr. Stanley Papadimitriou, the Council on Chemical Abuse Executive Director. Stan, are you there? I think I saw him come on and be admitted. Stan Papadimitriou?
He is on, but he is muted. He needs to unmute.
Stan, you need to unmute your phone.
Or unmute this one.
*6.
*6.
There, no, I think he hit the wrong thing. It looks like he might be leaving. He just left. So you're going to need to continue, Dr.
Okay, yes, I'll continue. I'm sorry. Next slide, please. I know Commissioner Barnhart is part of this, of course, but I want to talk a little bit about the continuing opioid crisis. In 2019, there were 126 drug overdoses in Berks County. This was the most deaths on record for any year. The Opioid Coalition has been working tirelessly, even during the pandemic, through virtual meetings to continue to address this through education, policy changes, and to work with key partners like the District Attorney's Office to make changes in the system. Our Warm Handoff program is one of the proudest parts of the Opioid Coalition and this system. Basically, this connects people to substance use disorder treatment upon admission to hospitals. We distributed Narcan kits in 2019. 319 were distributed to community members. An important part of this is the Blue Cares program. Although it wasn't invented or developed here in Berks County, it was in fact expanded upon in this county. This is when there is an overdose in a particular household. This pairs a person up from the drug and alcohol system with a law enforcement officer in that community, and they go to the individual's house and knock on the door to educate, provide support to the family. It's a true community policing initiative in consult and in collaboration with our human service agencies. Stan, did you join us? Okay, I'm going to keep going. As you can see, the warm handoffs in 2019 were 1,228. It's a very proud number. And the number of people out of that accepted treatment are 678. And I would argue that we would not have any of those people accepting treatment if it wasn't for the Blue Cares program and the Warm Handoff program. And I think that's an excellent point. Next slide, please.
Excuse me, Ed,
I think Stan is on.
Okay, Stan?
Yes. Can you hear me?
I just
Yes.
did your slide on continuing opioid crisis. If we could go back, I reviewed everything, but I'd love to hear from you.
Okay, thank you. First, let me apologize for the technical difficulties I'm having on my end. I'm trying to do it through my computer and my phone, and I've pushed a number of buttons in the past 10 minutes, so my apologies. So first, let me just give a thank you for the opportunity to be able to speak here today. Also, as always, a thank you to the Board of Commissioners. When I speak to my colleagues across the state, I become aware every time I speak to them how fortunate we are here in Berks County, not just as a single county authority, but as a county to have commissioners who are committed to the fight of fighting substance use disorders, both from prevention all the way through recovery. So a big thank you there. And that support just doesn't come in terms of funding allocation and those things, but I know with the 3 commissioners sitting there that you're all committed to the cause, so to speak, and are there to offer support as moral support, and that's a big thing. So thank you. I also appreciate the opportunity to be part of this block grant team. So thank you for that, working with Ed. And while kind of intermittently going in and out of this meeting, I caught a little bit about the flexibility that this block grant has afforded us. And I know my predecessor, George, was very supportive of the Human Services Block Grant. With that support, there was always some sense of, were we always going to be assured the funds that we had gotten before? And if anything, drug and alcohol has fared very well in this block grant setting. The flexibility of the funds has allowed us to put resources where they really need to be. And I have said this before, and I'll continue to say this, that the opioid crisis, while it has hit Berks County hard, it could have been a lot worse if we hadn't had the infrastructure in place that we do now. So thank you to the county, and thank you to all those on the block grant team. I understand that Dr. Mahalik went through part of the opioid crisis, and it still is a crisis. I think rightfully so, all of us are concerned about the pandemic that we're going through. But overdose crisis hasn't gone away. As you see, in 2019, our deaths went up. We recently got the coroner's report for June, and we're on pace to have probably the most overdoses we've ever had. Now, we still have a whole half a year to go, but it is concerning and troubling. And we continue to work on that. And the Opioid Coalition, SOS Berks, that is co-chaired by Commissioner Barnhart, whose tireless effort has helped keep that group together and focused and moving forward. We're continuing to work on efforts, whether it be educational efforts for the community, how to go get help, where to go get treatment, as well as Narcan, the opioid overdose antidote, if you will. So the group continues to meet. We do meet virtually. We look forward to the day when we might be able to get back into a room and meet, but it's working for us now, and we need to continue to work. I understand Ed spoke a little bit about Blue Cares, and in this environment that we are now, it's difficult to make those house visits in person with a law enforcement officer and a recovery specialist, but we're able to do these things via phone calls and reaching out that way to help do some interventions. I was on the phone earlier with our warm handoff program that is located at the Reading Hospital, the 24/7 unit that intervenes on folks who show up at the emergency room with any type of opioid or other substance use disorder. And they are, during April, there was a lull there during March and April as folks weren't going to the emergency room as much as they had been, but things are picking up. And as of this morning, they're at just about the same capacity that they were pre-pandemic. So that's picking up. We know overdoses are occurring. We know overdose deaths are occurring. The opioid crisis has not gone away. We need to continue to work hard on that. We look forward to working with SOS Berks to continue on these efforts appreciate all the various stakeholders from across the community that are involved with this to help fight this. So with that, again, my apologies for the technical difficulties I had coming in. But again, thank you for the opportunity to be able to offer some comment here. So thank you.
Thank you, Stan. One thing I would add is that there's a very strong relationship between the single county authority and the MHDD department by virtue of the fact that that Stan and I estimate 60 to 70% of individuals within our system share both mental health and substance abuse or addiction problems. So we work very much hand in glove, and very proud of the fact that we're able to transfer money with the commissioner's approval, and I thank you for your support of that, commissioners, so that we can continue to try to battle addiction and substance abuse. Next slide, please. Two more slides going forward. One thing that we have done, and I think it's important to mention in the COVID-19 pandemic environment, that we have sought waivers and approvals from the Department of Human Services to continue to pay our providers to provide services online and telephonically. And you can see that on the left side of the screen there. We have also received waivers from the Office of Mental Health to go forward with these waivers to continue to fund. Our providers are opening little by little with proper social distancing and masking in place and proper sanitizing procedures. But for those that still do not feel comfortable, we encourage them to continue to seek their care telephonically, telehealth, and we will continue to support that. I'm very happy to announce that on July the 14th, our new 144-bed freestanding inpatient psychiatric hospital that is a joint venture of Tower Health and Acadia Health Systems will be opening. We were able to, with the support of the Office of Mental Health at my request, to get the program licensed even during this time, and that hospital will open with proper precautions next Tuesday. So we are excited because up to this point, all of our children and adolescents and all of our 50% of our adults were seeking treatment outside the county, and now they will not have to do that. So that's I'm very pleased and never thought I'd be able to make that kind of announcement. The last slide, as I mentioned, is we're operating on a 5-month budget through November 30th. We are, due to the COVID-19 restrictions and other pandemic uncertainty, I encourage people to continue to access their services telephonically. We are here, our departments are open, our providers are open. We had those alternative payment arrangements I discussed in the last slide, and recently we received money through our homeless assistance program, and we're working with the Commissioner's Office, as well as the Coalition to End Homelessness and our Community Development Block Grant Program through Mr. Ken Pick. We were just awarded $245,000 to be expended by the Berks Coalition to End Homelessness by November 30th to do rental assistance so that people don't lose their homes, lose their apartments. I know also the city has another pot of money too that was awarded, and we'll be making an announcement. I believe the commissioners will be making an announcement early next week. On that case, next slide, and the last slide, please. We are going to, if we can get to the last slide, Heather, that would be great. I think we lost it somewhere. You can still email me. Last slide, next one. There's one more, I think. Okay, the reason that this is important is that if you would like to provide input via email prior to the submission of this plan, which I believe is next week, you can email me at that address, or you can email questions. We'll take some questions now, but that's at the guidance of the commissioners here, but this is how you can contact us. I thank you for this time, commissioners. I thank all of our human service partners, both within and outside of county government. That concludes my presentation.
Thank you very much, Dr. Ed. Thank you, Stan. Glad you were able to get on the call. Are there any questions from any of our participants? or folks online regarding specific aspects of the presentation? I don't see any online. Commissioner Barnhart.
Nothing relates to the presentation on the live event, so I'll move to close the public hearing.
Second.
The motion is made and seconded to close the public hearing. Any discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Aye. Opposed? The motion is carried.
I think it would be appropriate to adopt the resolution authorizing the execution of Appendix A fiscal year 2021 County Human Services Plan Assurance of Compliance Form while we're on it.
I have a motion. Do I have a second?
Second.
The motion has been made and seconded. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? The motion is carried. With that, we're going to move on to our agenda. I want to note that there's an opportunity here at the beginning of the agenda for public comment specifically related to agenda items. And at the end, we will have comment. You may comment a couple of different ways. If you're watching and listening via YouTube Live or Facebook Live, you can ask your question through that tool. It is being monitored. We must have your name and must have the municipality where you live. If you're from the media, we simply need your name and the media you represent. Again, that information is published in the Q&A area. Mary, are there any comments specific to agenda items?
There are not.
Okay, we will move into the agenda. Are there any additions or corrections for the June 25th, 2020 Commissioner meeting minutes? Hearing none, the minutes will stand approved as presented. I do want to note that we held an executive session yesterday dealing with personnel and litigation. Under item 1, authorizing Budget Department, adopt a resolution authorizing 2019 budget transfers in the amount of $3,985,319 and 2019 appropriations in the negative amount of $590,497, 2020 budget transfers in the amount of $1,089,000, and 2020 appropriations in the amount of $82,156 per listing dated July the 6th of 2020. We have one item listed under Human Resources, authorize the promotion of Matthew Sokowski from Interim Director of Facilities and Operations to Director of Facilities and Operations. Under Purchasing, adopt a resolution authorizing the award and the Director of Contracts and Procurements to execute as a result of an invitation to bid 4 contracts for the Berksheim Boiler Project. Those awards go to for general construction or Bolton Construction out of Richland, not to exceed amount of $1,168,564. Plumbing contractor goes to Trev's Mechanical out of Lansdale, a not to exceed amount of $132,139. The mechanical construction goes to Tri-County Mechanical out of East Texas, Pennsylvania, and that is a not to exceed of $1,569,000. And the electrical construction goes to Albarell Electric Inc. out of Bethlehem, PA, and that is not to exceed $196,000. We have a number of items listed under the Commissioners. Item A, adopt a resolution authorizing the award and execution of a 5-year lease agreement as a result of a request for proposals for county farmland to Roger Zweisig Farms out of Shoemakersville, Pennsylvania. Item B, adopt a resolution authorizing execution of the second amended and restated agreement between the County of Berks and the Community Care Behavioral Health Organization effective July 1 of 2020 through December 31st of 2021. Item C, adopt a resolution authorizing the chair to execute the agreement between the County of Berks and Mission Critical Partners out of Port Matilda, Pennsylvania, to provide network monitoring and on-site support of service aggregation routers to interconnect Reading Police Communications and the Berks County 911 Center for a 12-month period from the effective date of the agreement at a not-to-exceed fee of $3,353 per month. Item D, adopt a resolution authorizing and approving Berks Community Television to utilize a portion of the premises leased by the County of Berks at 601 Water Street, Temple, PA, for the temporary storage of excess equipment owned by BCTV upon the county's receipt of a certificate of insurance form and executed hold harmless agreement subject to final review and approval by the solicitor's office. Item E, adopt a resolution authorizing the chair to execute the investment advisory agreement between the County of Berks and Sterling Capital Management, LLC, to implement and manage the investment policy statement of the County of Berks, and be it further authorized that the Berks County Treasurer, Dennis Adams, and Linda A. Weaver, Chief Deputy Treasurer, are authorized to instruct Sterling Capital Management on behalf of the County of Berks regarding daily portfolio activity and investment policy decisions in writing, and are further authorized to execute the authorized signers list. This resolution replaces Berks County Resolution number 73-15, adopted March 12th of 2015. Item F, adopt a resolution authorizing the chair to execute the custody agreement between the County of Berks and Branch Banking and Trust, BB&T, for the general fund bond account. Item G, adopt a resolution of the Berks County Board of Commissioners declaring effective immediately that all in-county and out-of-county non-essential work-related travel is prohibited. This includes, but is not limited to, face-to-face seminars, conferences, and training. Any non-essential work-related travel is to be canceled and suspended until further notice. Travel planned but not yet booked, airfare, hotel, etc., shall be held off until further notice. Travel that has been previously authorized is rescinded. Travel requests must be resubmitted after these restrictions have been lifted. Travel that is prohibited does not include travel that is necessary to obtain or maintain required certifications or professional licenses. Travel is permitted to carry out essential services required by court order or travel to ensure the safety of the clients the county serves. Any exception to the travel policy must be approved by CAO Ron Seaman. Item H, adopt a resolution ratifying, confirming, and approving execution by the chair of the contract with Osmond Environmental Solutions out of Harrisburg, PA, to review and provide comments to the public notice published by the Pennsylvania Environmental Protection Agency dated June 6th of 2020, and/or submit said comments to the EPA on behalf of the County of Berks at a not-to-exceed fee of $2,500. Item I, adopt a resolution ratifying, confirming, and approving execution by the chair of the hardware maintenance and support services agreement between Election Systems and Software out of Omaha, Nebraska, and the County of Berks to extend the support services that ES&S is providing for the voting machine hardware for a 4-year period at a not to exceed cost of $453,500. Item J, adopt a resolution authorizing execution of the memorandum of agreement between Berks County and the Berks County Detectives Labor Organization, extending the current collective bargaining agreement for a period of 1 year through and including December 31st of 2021. Item K, adopt a resolution authorizing execution of the Berks County Drug Court Initiative Grant Project Modification Request and Amendment for the period October 1st of 2019 through September 30th of 2021. This grant is to enhance the day-to-day operations of the Berks County Drug Treatment Court. There's no additional money being requested. The $8,000 budgeted in year 1 for training is being moved to year 2. Item L, adopt a resolution ratifying, confirming, and approving Shelley O'Neill, Business Process Analyst and Project Manager of the HRMS project, to execute a change order dated June the 8th of 2020 to the AST contract for the Human Resources Project Phase 3. The change order allocates funds already included in the project from a reporting needs bucket to identified scope at no additional cost. Item 2, a motion authorizing execution of contract agreements and amendments as furnished by the contract coordinator as set forth on the attached listing dated July the 7th of 2020. There are a total of 31 contracts. There are 12 with the Area Agency on Aging, 1 with the Berksheim, 4 with CareerLink, 8 with Children and Youth Services, 2 with the Department of Emergency Services, 1 with Juvenile Probation, and 3 with Mental Health and Developmental Disabilities. Then finally, a motion to ratify and confirm payments as set forth on the Controller's Office voucher listing dated July the 7th of 2020 for the week ending July the 7th of 2020, and the payment of electronic transfers and employee payroll.
Motion to approve the agenda as presented. Just for clarification, item H, Osmond Environmental Solutions is with the Exide location.
That is correct, the Laureldale facility.
Second.
The motion has been made and seconded. Is there any discussion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? The motion is carried. With that, we will move to our Berks County Treasurer, Dennis Adams, for the Treasurer's report.
Good morning.
Morning, Dennis.
Good morning.
We have an opening balance of $217,537,647.90. A balance to clear of $4,320,937.42, leaving us with a balance of $213,216,710.48.
Thank you very much. We'll move now to Sandy Graffius, our County Controller, with the Controller's report.
Good morning.
Hey. Good morning.
We have 2 weeks to report because we did not have a commissioners meeting last week. So for the week ending 6/30, we had total cash disbursements of $6,047,304.93, and there was no payroll. Now for this week, we have total accounts payable of $5,604,767.30. We did have a payroll of $4,363,035.76 for a grand total of $9,967,803.06. Thank you very much.
Thank you, Sandy. We'll move now to our Chief Administrative Officer, Ron Seaman, for his report.
Thank you, Chairman Lineback. I have nothing to offer at this time.
Thank you.
Commissioner Lineback, I have 2 other executive session items to announce that I neglected to send you this morning.
Okay, what are they?
So there was also an executive session held on the 7th of July to discuss litigation, as well as an executive session on 6/30 for litigation purposes as well.
Thank you very much, Christine. Appreciate that clarification. With that, we'll move to Commissioner Kevin Barnhart for Commissioner's reports.
Thank you, Commissioner Lineback, and everyone who has joined us this morning. I want to thank our detectives organization for agreeing to extend the contract for an additional year to give us some breathing room with COVID-19 and our HR staff and legal staff. So kudos to them for being team players. I also want to thank everyone who was involved and engaged in the move of Epler School to the Heritage Center. That was quite an endeavor. I was there for almost the entire move, so it was fascinating to see the technology used to move that school as well. Still time to fill out your census online. My census is online. We strongly encourage people to fill out the census. It's a critical component to have the proper federal money allocated to Reading and Berks County that this area richly deserves over the next 10 years. It's an average of $2,100 per person times 10. So that's $21,000 that each person that is not counted, we're missing out on in federal monies. That is, runs the gamut. 132 federal programs are keyed off the census. So please, if you have filled it out, that's good. Talk to people that you know who have not. Want to just briefly touch on the CARES Act again. We're about to receive our $38 million CARES Act allocation, which has specific guidelines. It's for the cost of the county to offset response planning and outreach efforts, purchase of personal protective equipment, small business grant programs, assist municipalities for response and planning, behavioral health and substance use disorder treatment, not-for-profit assistance, broadband deployment. It does not cover for lost revenue. So we have our community needs assessment up on the county website. It is available in Spanish if necessary. Thank you, Michael Rivera and Barbara Lopez. If you have any questions, it's communityneeds@countyofberks.com. That's our email address, communityneeds@countyofberks.com. We highly recommend, if you feel as though your organization has the ability to apply for some of this COVID funding for issues related to COVID-19, please go on and view the tutorial. It's about 20 minutes of very valuable time. Justin, Luce, and I walk you through the actual assessment. And then there are 5 different component parts of the assessment. Please print that off and use it as your workbook as you're filling out, because we're looking for the information from March through the end of July, and then an estimate of expenditures from July to the end of the year. We have to start our reporting to DCED in September. So the very first large allocation that we have to explain is going to be from March through July, and then monthly from that point on. Again, so far we've received several dozen responses to the assessment, and the assessment is really going to help this board determine how to properly allocate this money to be used in the most efficient fashion in Berks County to help people recover and move on from COVID-19. So the deadline was originally this coming Monday, a 2-week period of time. We're being very flexible with that. That was trying to give us a snapshot of where we are financially with the request, and the requests are potentially fall right into our CARES Act allocation, or they could go to another one of the hundreds of other CARES Act allocations. We received another notification this morning, or 2 or 3, from the governor's office about additional CARES Act monies. So again, we've engaged with O'Brien to help us to lead people down the correct path in order to properly apply for the CARES Act money. There are other loans out there for small businesses. There's other grants out there for renters. Those are all separate from this CARES Act allocation. Last but not least, I do want to give the weekly update on the contact tracing. Through Co-County Wellness, there are 6 functioning tracing teams. The teams are comprised of part-time paid staff, volunteers, and bilingual individuals. There's a backup team comprised of 6 of her staff to fill in and supplement in times of greater need. There are 10 interns from Kutztown University Social Work Department on track to be trained tracers on August 20th and will fulfill their internship. That's very good. Requirements as contact tracers for Cook County Wellness during the fall semester. They'll cut off hiring part-time paid staff at 10 for now, although others are cleared and on a waiting list. The volunteer help in this community has been outstanding. Again, kudos to Berks County. When times are tough, Berks County steps forward. To date, 178 contacts are in the database. 19 have refused contact tracing. That's 11%. I think the number I saw in Lancaster the other week was like well over 50% refused. So again, very appreciative of people understanding contact tracing is extremely important. If approved by University Administration, Alvernia and Kutztown will also like to rely on Cook County Wellness for their contact tracing. Penn State Berks is waiting for direction from main campus and have not heard from Albright as of yet. If they are given the green light, they will work out an information sharing plan to best obtain what other information they need. So they're also being contacted by employees of long-term care facilities in our county. Currently, the facilities have been trying to do that in conjunction with limited support from the State Department of Health. So thank you to my colleagues and everyone else involved in this, and Dr. Ed Mahalik for stepping out forward for the contact tracing, not waiting for the state to come in because the state is still overwhelmed and overburdened. So it was a really good decision that was made about 2 months ago to engage Cook County Wellness. Again, the experts in this field since the early 80s during the HIV epidemic. So thank goodness we have them here and they're great partners so far. So those are the items I have today. Thank you.
Thank you. Commissioner Rivera.
Yes, thank you, Commissioner Leinbach, and Commissioner Barnhart. Thank you for all the valuable information that you shared and all the work that you're doing to help Berks County move forward. Appreciate it. And just wanted also to thank you because it was you and your assistant, Jessica Blauser, who actually requested that the community needs assessment be provided in Spanish as well. So I do appreciate you thinking about that and making sure that it gets done. A few things here. I want to thank Dr. Ed and Stan for the presentation they had and for the work that they've been doing in the area of mental health, developmental disabilities, and Stan and COCA with addiction issues. Appreciate all you do. COCA, I've been known Stan from COCA many years. I was on their board many years ago, and they've always done a great job there. So I appreciate all that you do and all that you continue to do for our community. And I'll continue to support you as much as I'm able to do so. Thank you. Second thing I wanted to talk about is the small business grant. Hopefully you've heard about this before. So please don't get tired of hearing about it again, because we do need you to help get the word out to our small business owners in the county about this program. And this is a Restart Grant program that the county is working on together with the Redevelopment Authority and Neighborhood Housing Services of Greater Berks. And it's for small businesses that have been affected by COVID-19. Grant amounts are between $2,500 and $10,000. They do not have to be repaid. Initially, the program had started out as a repayable loan of 50% of the amount of the loan. But based on the feedback that we received and the needs of the small business community, that was then changed into a grant program because that's business owners were saying, you know what, we don't know what the future is going to hold. We don't know if we're going to be shut down again, and we really can't take on any other debt. So that's why it's being done as a grant program. So please help get this information out. It's there to help our small businesses get back on their feet, restart, hire employees back again so that they're able to continue to grow. The application deadline is July 17, and you can find the application on the Neighborhood Housing Services website, which is nhsgb.org, and that stands for Neighborhood Housing Services of Greater Berks. That's nhsgb.org. You'll find the application there. There'll be a frequently asked questions section as well. If you prefer to actually download the application, complete it manually, and take it in, you can do that as well. Once you go in to where you'll find information on the loan. There's a downloadable application there that you can do, that you can complete and hand in. There is some documentation that the business does need to provide for the grant to be able to assess what their needs are. So please go in, have that ready. It's not first come, first served. All the grants will be looked at and will be then scored, and how much you get will be based on that. But please help us get this information out to our small business owners. I know a lot of people aren't aware of it, so we're doing all we can to get this information out there. So please help us get this information out. Something else that we're working on as well that's of extreme importance, especially now, is a rental assistance program. The rental eviction program, rental eviction moratorium expires tomorrow. So as of tomorrow, the process for evictions for non-payment of rent will be able to start up again. So it won't be an overnight process for someone to be evicted, because there is a backlog. But it is something that's starting up again. And the goal is to be able to help people stay in the places they're at now, rather than having them being evicted, having to find temporary housing for them and then permanent housing. So we want to make sure that we get this word out as well. And there are different programs out there. I'm not going to go through all the programs, because each program, depending on where the money comes from, it has different guidelines, it has different requirements, and what can and can't be done. And there's maybe 4 or 5 of those out there, but there are different programs. What you need to do is, if there is someone that needs this assistance, they can contact the Berks Coalition to End Homelessness. Again, the Berks Coalition to End Homelessness, and their website is bceh.org. That's bceh.org, and their phone number is 610-372-7222. Again, that's 610-372-7222. And so there are different programs there. There are also programs that are specific for the city, programs that are specific for county excluding the city, and programs for the whole county as well. And again, that depends on where the money is coming from. That determines where we can use that money. So please reach out to the Berks Coalition to End Homelessness. If you live in the city of Reading, you can also reach out to their Human Relations Commission, or get more information at the website at readingpa.gov. Again, that's readingpa.gov. And there is an application that you need to fill out. There is documentation that you need to provide. So please be as thorough as you can completing the application. Provide all the information that is requested. If you don't do that, your application will not be able to be processed. One of these programs is from PHFA, which is the Pennsylvania Housing Finance Agency. It's part of the CARES Act money. The Commonwealth is running it through the PHFA. This program, either landlords or tenants can apply for this money. If it's the tenant, they go directly there. If it's the landlord will need to work with the tenant for that. But it's up to 6 months of rent, up to $750 a month in this particular program. So it's up to $4,500. Right now, Berks County was allocated $1.4 million. And we could have up to $4 million depending on the need that we have and the use of that money. So please, let's get this valuable information out there as well. And one other thing I want to touch on before passing it back over to Commissioner Leinbach is just want to reemphasize that we are in the green phase. The green phase doesn't mean we're out of this. The green phase doesn't mean we're in the clear. The green phase means that we're going to have to continue to wear a mask, that we're going to have to continue to social distance, that we're going to have to continue to wash our hands regularly and do certain things to be able to stop the spread. I understand, and I've said this many, many times, it's not comfortable to wear the mask. I don't like wearing it. You go out, it's 90 some degrees outside and you have to go to the store, you're putting your mask on, or you're at an event, you're putting your mask on. But for me, it's something I need to do because I feel it's important that I protect other people, and hopefully other people will feel that's important to protect other people as well, because my mask protects you, your mask protects me. So please, let's look at this as something that we need to do for now. At some point, we will get over this. We'll be able to look back at it and say, you know what, look at what we had to do, but we can understand that each of us did our part to be able to get through this. So please, also ask the businesses that are out there, help do your part as well. I've spoken with many business owners. Businesses are not back to normal, many of them. It's because people aren't yet comfortable going out and going into public places with a lot of people. So the more the business owners can do to ensure people are wearing their masks, that there's the social distancing, that they're cleaning properly, this will allow people to feel more comfortable, be able to go out and utilize the different stores that are out there, which will continue to be a benefit to our economy. So thank you for everyone who's doing your part to stop the spread. And please, this is not over. Let's continue to everyone do their part. Again, I know it's not easy, but let's, hold on for a little bit longer and we will get past this. I do promise you that. All right. Commissioner Leinbach, back to you.
Thank you very much, Commissioner Rivera and Commissioner Barnhart, for your informative reports. I'm going to pick up where Commissioner Rivera left off. I'm sharing my screen. These are headlines from the last couple of days. I'm going to start actually with the Washington Post. Live updates, U.S. sets another daily record for coronavirus infections. That is from yesterday. Healthline, U.S. may be headed for a full-blown COVID-19 outbreak. How to prepare. If that doesn't concern you, this is from July the 7th, 2 days ago, U.S. News. U.S. coronavirus cases near 3 million as hospitals in Sunbelt fill up with patients. I highlighted this yesterday. We're not simply talking about a rise in cases either because there's more testing or because of young people involved in a lot of different various activities. We're talking about hospitalizations. We're talking about serious issues, and we need to take this seriously. I just posted on a link to this page on CDC explaining that the use of cloth face coverings do help to slow the spread. So that is information that's available out on our Microsoft Teams Q&A section, and our IS department is also loading that information on YouTube Live and on Facebook Live. The second note that I want to make is, and I'm trying to see here, are we still live? There we go. Okay. The second point I wanted to make, I want to thank our district attorney and our president judge. 2 days ago, the commissioners received an email from our district attorney outlining information regarding a Berks County constable by the name of Pete Dardis and some clearly racist and, in my opinion, horrific Facebook posts made by an elected law enforcement officer. I was thrilled to see John Adams act immediately, work with the president judge, and as I think everyone is aware, the president judge took action yesterday to remove Mr. Dardis from his position as a constable. I'm just glad that it didn't take a big discussion. It took two people stepping up with the authority to do so, one to investigate, the other to take action. The last thing I want to highlight is recently there was a court decision regarding a request of individuals to request an emergency removal order of the residents of the Berks County Residential Center. I want to read some of the decision from the judge in that order. Petitioners, and in this case, the petitioners are those that wanted the individuals removed from the residential center. And I'm quoting now, petitioners point to their subjective and unsupported allegations as the basis for claiming that the conditions at the BCRC and the facility's response to COVID-19 pandemic demonstrate gross incompetence, negligence, or misconduct likely to constitute an immediate and serious danger to their lives or health. The uncontroverted evidence belies the petitioner's subjective fears and demonstrates that the BCRC has taken steps to mitigate the risks of residents being exposed to or contracting COVID-19. Specifically, BCRC suspended admissions, visitation, and field trips as of March 18th of 2020. Staff has been trained regarding the CDC's COVID-19 guidance and are required to adhere to the CDC's infection control guidance pertaining to hand hygiene, respiratory hygiene, and cough etiquette. While petitioners claim no one from BCRC ever spoke to them regarding COVID-19, Director Edwards credibly testified otherwise. She specifically stated that the staff met with each family unit to educate residents about COVID-19 and that a translator or language service was available during those meetings. Despite petitioners' allegations to the contrary, BCRC has adequate space for social distancing as it is a 58,000 square foot facility with an additional outdoor recreation area of at least 3 acres. While BCRC can accommodate up to 96 residents, it currently only houses 13 residents, and each family has its own bedroom. Moreover, BCRC has instituted policies that stagger the use of common showers and entry to the dining area to avoid families being in contact with one another. The ability to adequately socially distance exists at the BCRC, and it is incumbent on the residents to follow this practice. As for cleaning and PPE, BCRC has significantly enhanced its preventative cleaning of the facility. It has also provided at least 11 hand sanitizer dispensers throughout the facility for both residents and staff, and residents are encouraged to wash their hands. Staff are required to wear face masks and gloves at all times within the facilities, and there are 12 glove stations located throughout the BCRC, including in the common areas. While residents are typically only provided 1 disposable face mask per week, they can request and will be given a new disposable mask at any time, and they also have been given reusable masks. Again, while the record contains evidence that the residents do not always practice social distancing measures or wear their masks, that is inherently by choice and not due to the lack of ability. With respect to medical care, there are over 15 full-time medical staff at the BCRC, and the facility has developed specific policies for placing a resident in quarantine if he or she presents symptoms of COVID-19. In addition, if a resident tests positive for the virus, he or she will be placed in medical isolation in a negative pressure room. Sick calls are available twice a day for adult residents and are always available for child residents. The residents were given a medical examination and screened upon entry to BCRC, and medical staff takes the temperature of all residents every day prior to lunch. BCRC staff has also been screened daily since March of 2020. Staff are not permitted to enter the facility if they have a fever of 100.4 or higher, or if they fail to appropriately answer any of the daily screening questions they are asked. No resident or staff have tested positive for COVID-19. The court does not doubt petitioners' testimony or the fear they expressed for themselves and their families during this unprecedented time. However, these subjective concerns do not support the extraordinary remedy requested here, especially in light of the department's ample evidence regarding BCRC's mitigation efforts. Given the facts of the record, petitioners simply have not demonstrated a clear right to an ERO. And I will end my comments. Well, actually, I'll go down to the conclusion. In the conclusion, it says petitioners have failed to prove they have a clear legal right, and the department has a mandatory duty to issue an ERO, two necessary elements for the issuance of a writ of mandamus. Moreover, the court finds the department, in this case it's the Pennsylvania Department of Health, acted reasonably in determining that an ERO was not warranted under the circumstances. Accordingly, the court finds in favor of the department against the petitioners. Those are the comments that I have. At this time, we'll open it up to any comments from our row officers. Hearing no comments from our row officers, we will open it up to public comment. Again, I want to reiterate, this is a public comment period. It is not a question and answer period. When the comments are completed, the commissioners do reserve the right to make any additional comments. Mary Buer, please read the comments.
Liz Cates, Bern Township. Will you do the righteous and courageous thing and shut down Berks Family Detention Center? Risa Marmontello, Amity Township. The June primary showed that Berks County voters have confidence in the mail-in voting system, with over 39,000 voters choosing to vote safely from home. Will the county be looking into secure drop-off boxes to further expand this program for the general election in November? Troy Turner from Reading. Commissioner Rivera, you said you were upset that protesters projected the sworn statements of detainees onto the outside of your house. You didn't like lights shining in your windows. I think everyone can understand that because we all want to be able to live in peace. But do you realize that ICE shines lights into the faces of asylum-seeking families, including small children, every 15 minutes in the night? You were able to go back into your comfortable home that night, but the detainees are locked up in close quarters in the middle of a pandemic. You have said you're in favor of closing the facility, and yet you have done nothing to make that happen. People have been asking the commissioners and the governor to shut it down for years. For years, we have called, written emails and letters, collected petitions, visited your offices, even gotten arrested. The nonviolent direct action at your home and that of Commissioner Barnhart was a result of your inaction. Chris Ellis, Reading. The Berks Republican Party recently put out statements on social media casting doubt on the usefulness of masks and told their followers to not wear masks. Commissioner Leinbach and Rivera, as Republicans, do you disavow and publicly condemn this unsafe and potentially deadly statement from the representatives of your party? Jane Palmer, why I'm missing. Former Pennsylvania Judge Michael Conahan, who was involved in a despicable scheme to send children to a for-profit jail in exchange for kickbacks, has been released from federal prison with 6 years left on his sentence because of coronavirus concerns. How in good conscience can you continue to incarcerate people during a pandemic while this guy who did such tremendous harm to children is set free? This is kids for cash all over again. Lou Spencer from Reading. A Commonwealth Court judge has just denied a petition to release the detainees in Leesport, claiming there is insufficient evidence that they are not well cared for. Commissioner Barnhart claims the same thing, and yet the sworn statements of detainees and immigration attorneys make it clear that detainees are sick and scared. Haitian asylum seeker PM says, since we arrived at Berks County Residential Center on March 18, along with my wife and my 2-year-old daughter, my child has been severely sick, and my wife and I have reported it to the medical staff every day since we arrived. She has bumps all around her mouth, chin, and lips. Sometimes they bleed. Her throat is severely swollen so that she can't keep any food inside. She has been feverish. Even though we reported this to the medical staff every day, they did not start giving her medication until March 30, 2020. But the medication did not help. Commissioners, virtually every other prison and detention center in the country is a hotbed of coronavirus. Why do you persist in maintaining this cruel and inhumane facility in Berks? Jess Royer, Spring Township. First of all, even without a global pandemic that we here in the United States are handling fairly poorly, Berks County is absolutely in need of a health department. I appreciate and am thankful that you, the commissioners, have maintained consistent messaging throughout the coronavirus pandemic in asking residents to wear masks, social distance, and be a part of stopping the spread. However, we need to acknowledge that Berks County would benefit from stronger data, quicker reporting, and a more coordinated handling of complex health issues. What can we do to join our neighboring counties in protecting the health and well-being of county residents? Secondly, I understand from your press conference yesterday that there is a fund available that tenants and our landlords can access to make up for rent payments. Is this a county initiative? And if not, how can Berks ensure there is nobody left out that needs that assistance? Are the funds coming from the state or federal government? How much money is being made available? Are administrative costs going to take away from the money that's available to those in need? Since tomorrow marks the resumption of evictions, could you please make sure again people know where to go to access those funds and make clear how tenants can work with their landlords to prevent becoming homeless? Thank you. Crystal Kowalski, why I'm missing. Evictions are scheduled to resume on July 10th. Is there any discussion about pushing the state further out? Have we established a county-wide rent fund? How much total money is available to tenants? Henry O'Leary from Kumu Township. Excellent presentation on all the wonderful work you're doing on the opioid crisis. Since that crisis continues and is layered on top of the coronavirus crisis, wouldn't this be a good time to convert the BCRC to a treatment clinic? Laura Song, Reading. Sworn statement from GSC, one of the detained asylum seekers the commissioners refused to protect from a global pandemic, despite Judge G's recent decision to release all children from family detention centers. I feel like, this is in quotes, I feel like we have been here for a while. We are scared that the new detainers that are coming could bring the virus to this, will bring the virus to this facility. Our children live here, end of quote. Last month, when I spoke to a female officer who introduced herself as Berks' supervisor over the video call, she told us she promises they won't bring any new people until they are going to release us. but now they are bringing new people from the border. Amy Levengood, Amity Township. My question pertains to the Berks Detention Center and the current COVID-19 pandemic. How many people have been incarcerated there since January 20th, when the first case was identified in the US? And how many have been tested for the virus? Are families being provided with PPE? If not, why? And in terms of the children being held there, what is the status of their education? Celine Schneer, Center Park. On June 26, Judge Dolly G. ordered that the federal ICE detention centers release immigrant children being held instead of complying. They have been searching for a way to deport. Instead of complying, they have been researching for a way to deport the parents and separate the children. Members of this board have publicly stated that they support the shutdown of the center, but have claimed it is not a priority at the moment. During COVID-19 pandemic, there has never been a better moment for you to stand up bravely and clearly show us which side you are on. I implore you, just one moment. I implore you to look at yourself and ask a few questions. How can you claim the safety and freedom of these immigrant families is not a priority? Why do uphold the income is more valuable than human lives? How can you claim that civil disobedience is more deplorable than imprisoning innocent families? Why do you deserve to have your privacy protected when you do nothing while it is stripped from immigrants? Berks County is better than this. You have a chance to finally right this wrong. It is time you shut down the Berks Detention Center and defund the police to reinvest those funds into public housing, education, food insecurity, healthcare, and more that would truly serve and rebuild our community. Bree Tyson from Reading. A Commonwealth court has just denied a petition to release families from the detention center, claiming they're fine. The detainees have noted they are not fine. So how do we release them, and why have we not released them yet? Laura Knapp, Shillington. Apologies, she does have her name and municipality, but originally must not have. I forgot to post my name and location. Anyways, to get back to my original point I posted before, you can have as many initiatives as you want for people coping with addiction. If people have to worry about the costs of rehab, they are not going to get the real tangible help they need. Mark Detterline, City of Reading. A United States Bureau of Labor Statistics report published in September of 2019 states that, in quotes, 84% of wage and salary workers worked a regular daytime schedule in 2017-18, end of quote, or first shift. Almost all township supervisors, township commissioners, city councils, school boards, zoning boards, etc. meet in the evening. I am almost never able to attend these meetings because I have a normal 8 to 4 job work obligations. Is there a particular reason that the Berks County Commissioners think it is appropriate to continue to hold meetings at 10 a.m. on a Thursday? And if they do find it's appropriate, what is the reason they are comfortable with disenfranchising roughly 84% of the populace? Jennifer Hanf from Mooresville. Dear Commissioners, first, I am concerned about long-term economic recovery of Berks County and Reading. I am hopeful that our commissioners will, with their power, ensure that all communities, urban and rural, experience an equitable recovery. COVID-19 is hitting recovery. COVID-19 is hitting communities of color harder and making poverty an even bigger factor in terms of access to needed services. We need to respond with recovery funding where it is needed most. Thank you especially for everything that you are doing to prevent evictions. How can we make our goal to have less people homeless, more people with access to recovery dollars, and a county where things are improving evenly? Second, I am concerned about the continuing division created by detention of immigrant families in the county's residential facility. There are no COVID-19 cases there now, thankfully. However, there is much more to the argument of ending Berks' participation in the immigration detention system than even a pandemic can provide. We can disagree about the degree and impact, but until our federal government has a humane and comprehensive immigration policy, we are complicit in a system that is deeply flawed. According to Amnesty International, the U.S. immigration detention system can be described as a purgatory of legal limbo where the core American value of due process does not apply. Investigative news reports have exposed a litany of human rights abuses in the detention facilities, including physical violence, the use of restraints, and substandard medical care. This description is not acceptable. Our county should not continue participation in this flawed and controversial system. Instead, we should be making life better for our residents who need county services. Together as a county, we should be discussing ways to work towards national immigration legislation as U.S. citizens. I welcome any comments from the commissioners, and she quotes her source. Manuel Sanchez, Exeter, shut down Berks. And I believe that's the end of the comments.
Okay, that closes our comment period. I have no additional comments. Do either Commissioner Rivera or Barnhart have any comments?
I do, Commissioner Linebaugh.
Go right ahead.
In response to Risa Marmontello, I will refer her to the United States District Court for the Western District of PA civil action brought by Donald J. Trump for president and the Republican National Committee. They have sued, and I'm sure you've read this in the news media, they have sued the state and each of the 67 counties, and we're moving to expedite this through the process. They have alleged that there is not the proper and functioning poll watchers, that people are harvesting mail-in ballots, specifically in Philadelphia County, driving by in vans and picking up people's mail-in ballots. And they're strolling against drop boxes, which the county, the election board never supported drop boxes out anywhere in the community for specific reasons like, how can it be secured? Let's hypothetically put a drop box for a mail-in ballot at the Berkshire Mall. Who's going to stand guard with that box? What if somebody walks by and puts a lit cigarette in the box? There goes all the mail-in ballots. The only safe and secure way is through the U.S. Postal Service with a stamp or bringing your mail-in ballot into election services. That's what the county has done, and that's what the county will continue to do. If you want a copy of the civil action, I can certainly get it to you. With respect to why do we meet on daytime, that's when we work, Mark Detterline. When you recall supervisors, hearing boards, borough councils, they are part-time people, just the same as you are as a school board director. You work during the day so you can meet at night. We work during the day, we meet during the day. Any county constructed like Berks County, which I think there are all but 7 or 9 that are home rule, meet during the day. The home rules, because they are part-time legislative council commissioners, meet in the evening. So that is the purpose. We meet during the day because we work during the day. Last but not least, I wasn't going to refer to this, but Commissioner Leinbach pointed out some of the very salient points on the Commonwealth Court decision on the BCRC. I want to again publicly recognize the efforts of Diane Edwards and her staff there. I've been saying this for 13 years. These folks are dedicated, hardworking. They're not guards. They're not enslaving people. They thoroughly enjoy their work engaging with the immigrants. They have, some of them are our most tenured employees in Berks County, and I want to thank them for reading this court case, commending their ability to pivot and really make that place more safe during the COVID-19 pandemic. And they do not shine lights in the eyes of the immigrants. They put a flashlight on the floor to check on the safety and well-being of the people while they're asleep. It's part of their job as caseworkers when they're walking the halls to make sure everyone is safe and secure. Another comment was about family separation. I never believe in family separation, never would. And going back to July of last year, when I announced that I had altered my position on the Berks County Residential Center, the tipping point for me was when the Department of Homeland Security asked if they remove the families and repopulate the building with single males, up to 400. Locks, fences, gates. And that time I said, no how, no way. I have been satisfied and very pleased with the care of the intact families at the BCRC for all these years. And if you intend to change the population to something different, then I'm out. Because I truly believe in the family unit keeping people together. There was another comment about their education. That's through BCIU here in Berks County. And I would argue that I think the several children out of there are under the age of 3. So I suspect they're not in classrooms. But when there have been older children there, they have received classroom instruction day in and day out. So I just want to, and the last but not least, there's a misquote that I told Karen Shuey when the folks decided to visit my house the other week. Thank you very much. That when she called me the next day, and I said, that is a misunderstanding. I received a call from Jane Palmer back in April, about a 45-minute, 50-minute conversation. She knows my number. She knows how to get a hold of me. We talked about the Immigration Center. And I said that I don't think Governor Wolf, in the middle of a pandemic, has time to be concerned about the Immigration Center, the residential center. I didn't say I didn't have the time to deal with it. I said, I don't think him, in the middle of a pandemic, right at the height of the whole thing, God only knows where we were going at that point, that on his list of things to do is to be concerned about the residential center. So that, I think, was taken out of context. And I've said since last July, and again, the Wolf administration has announced in the newspaper article, they're willing and able. Here it is, I have it right here. The Wolf administration will work with federal and Berks County officials to ensure the safe release of people in custody and provide any assistance necessary, the statement said. I'm still waiting for the call from Governor Wolf to talk about repurposing the building, finding employment for 60 dedicated, hardworking county employees, and the right purpose for that building long term. Thank you.
Thank you very much, Commissioner Barnhart. Any other comments?
Yes, I have some comments as well. Just a few things. One, on the date of the eviction extension, that comes from the state as of now. I have not heard of any extension on that. Could it come today or tomorrow? It could, but I have not heard anything on that yet. Also in reference to the cost for rehab, I don't know how that works, but something you should definitely reach out to Dr. Mahalik or to Stan at Coke and find out what options there are available out there. Also, I want to echo the comments of my colleagues in reference to the BCRC. I want to thank Diane Edwards and her staff there for the work that they're doing. As Commissioner Leinbach read, the residents there were tested for COVID. I believe it was a week and a half or 2 weeks ago. All came back negative. The workers, the staff there they're tested. They have to go through protocols to be able to enter the building, and they are doing their best there to be able to keep the residents there safe. So I want to thank them for the work that they're doing. I've just going through these comments. I've heard there's many different comments on there. Some of them I know is a lack of information. And the one specifically where Troy says that they've been reaching out for years and with emails and letters, collected petitions, visited offices. And I understand that, again, like I said, when they showed up at my house as well, I understand the passion. Going to my house isn't going to make me change my mind. Something that I say to people frequently, we can have a discussion, we can talk about a topic. You can expose your points, I'll expose my points, but because you're exposing your points and because you have a passion about something, it doesn't mean that I have to agree with what you're saying. I'll respectfully have a conversation with you. Again, I'll hear your points, you'll hear mine, but it doesn't mean that we have to agree. And I think this is the situation here. Troy's saying that they've been asking the commissioners for years and years to do something, so they feel that the commissioners are obligated to listen and do what the group wants. When that's not the case, the commissioners have listened, but they have their decisions that they make. I've only been here for 6 months, and I've, again, have never received any call or email or any type of correspondence from a lot of the groups that said that they've been trying to reach me for a while now. Yes, they did talk to me on the campaign trail, but again, it doesn't mean that because you express your point of view to me that I have to change my mindset. And some points we just have to agree to disagree in that aspect. So again, I want to commend Diane Edwards and her staff for keeping the residents there at the BCRC safe and COVID-free.
Thank you very much, Commissioner Rivera and Commissioner Barnhart. I appreciate your comments. With that, I will accept a motion to adjourn.
So moved.
Second.
The meeting is adjourned.